Good morning, everyone. There's a new movie in town. It's coming to a cinema near you, and everybody's talking about it. Very exciting. It's going to be the next blockbuster, this. It's a disaster movie, and it's set in the not-so-distant future in a society where hundreds of thousands of people are dying because of untreatable infections. It's a movie about trying to find a cure, because there is no cure. There is no cure for these infections. There were infections we could once cure and treat, but we can no longer treat. The economy is diving. The healthcare costs and loss of productivity are in the billions in this society, and there is no prospect of an answer or a solution. People are getting sick in the hundreds of thousands. Hospitals have become ghost towns. Nobody's going to hospitals. Not only is there no cure, but when we go to hospitals, we're finding in this scenario that people actually get sick, that they're not treated, they don't heal, per se. So nobody's using the hospitals. They're completely empty. It's almost a dystopian, sort of post-apocalyptic scenario. It's a film, it's coming your way, and it's not a silent film. It's not a silent film because AMR is not a silent pandemic. It's only silent as long as we allow it to be silent. It's not silent for the 85,000 people and their families who are lost to AMR-associated deaths per year in the European region. It's not silent for the billions in terms of costs of healthcare and loss of productivity in our region, in the European region. And it's not silent for the fact that less than a handful of new antibiotics have been developed with unique characteristics over the last 20 years. This is a very concerning situation and, of course, a very alarming situation. And it's not an unreasonable scenario for a blockbuster film. Indeed, we've seen the trailer for this film, right? The trailer for this film was a pandemic, a disease we couldn't cure, a disease that ripped through our societies, which we could do very little about. So we have the precursor, we have the preview, we have the trailer to this blockbuster film, and still very little action is being taken. We still have a serious issue with financing around and political commitment to antimicrobial resistance. Of the 47, 48 national action plans we have in the region, only 11 of these are financed. Quite honestly, a national action plan is worthless unless there is financing behind it. So, of course, in this scenario that I'm painting, this blockbuster film that I'm painting, that is not so far from an imaginary future, it doesn't exactly breed trust and confidence in authorities and in the health services we provide. And that's why we're talking today about and asking the question of the panel, but also of you, that does antimicrobial resistance, does AMR erode trust in the health system? And I'm going to be putting these questions not just to the panelists, but I'm going to be putting them to you as we move to discussion later on. My name is Rob Butler. I'm the Director for Communicable Diseases, Environment and Health at the regional office in Copenhagen, the regional office for Europe in Copenhagen. And I'm very, very happy that AMR is on the agenda at this meeting, and the first time it's featured as a topic of the Tallinn conference. And indeed, the efforts to tackle AMR are extremely and very relevant to the values espoused in the 2008 Tallinn Charter to strengthen and safeguard European health systems today and, of course, in the future. And that's why we're holding this short session with you this morning. We'll be talking about people, we'll be talking about patients, health professionals, health leadership, getting different perspectives on this challenge that we have ahead of us, this alarming challenge that we have ahead of us. And I'll be asking Danilo in just a few minutes to speak about the AMR roadmap that was endorsed at our regional committee in Astana just a few months ago. Indeed, it seems that AMR is everybody's business but nobody's responsibility. And what we're going to be talking about today is how we as individuals and constituencies and organisations can make it everybody's business. To begin this session and to set the scene, I'm going to go to Maria, who's presented us with a very nice audio message. Maria is a patient who'll share her journey in the fight against AMR. I'm not going to say much more about this, but I'll go to Maria and then to Danilo, and then I'll introduce our other panelists shortly thereafter. I'm going to go to introduce her as somebody she believes AMR should be everybody's business. So this is Maria Silva, an infection prevention and control nurse and sepsis survivor. And I'm very grateful to Maria, who can't join us today, but has sent us a short message for me to play.
My name is Maria Silva. I'm Portuguese. I'm 64 years old, and I'm a sepsis survivor. I'm also an infection control nurse practitioner. In 1996, I was admitted to a surgery for the removal of an ovarian tumor. At the time, I was 37 years old, a wife, a mother of two daughters with 9 and 12 years old. Immediately after the surgery, I experimented high fever, intensive abdominal pain, and general discomfort. I was prescribed antibiotics and discharged from the hospital, but I did not feel well, and I expressed it. When I got home, the intensive abdominal pain and fever continued. I remember thinking I would go into shock with so much pain. After only a few hours home, I went to the emergency department. I recall asking my colleague in the emergency room to save me because I felt like I could die quickly. I was immediately transferred to the intensive care unit, where it was discovered I had developed a severe post-operative hospital-acquired infection. I went to the operating room 5 times during my hospitalization. Through the hospitalization, I have many complications, and I developed several bacterial and fungal infections resistant to antimicrobials. I was given multiple courses of antibiotics and antifungals to treat the very infections I suffered. At one point, the doctors told my husband that I would probably die within hours. My daughters and my husband say goodbye to me. I was a miracle. I survived. I spent a lot of 64 days in hospital, 55 of which were in the ICU. I was already an infection control nurse before my episode of HEI, and I was very aware of the problem of HEIs and IMR. But after this personal experience as patient, it became a priority for me, promoting training of healthcare professionals to raise awareness of this problem of patients who suffer from HEIs and its consequences and to prevent AMR. I have tried hard to keep working with this goal. I think that is very important to raise awareness among governments and healthcare managers to properly value these situations and to support the needs of patients involved in the HEIs and their families. I think that all care settings must implement an active antibiotic stewardship program focused on improving antimicrobial use and prescription. The antimicrobial stewardship program would improve the treatment of infection and the patient outcomes and could improve the quality and safety of healthcare and the patient's quality of life. This is very important too. It's especially important that managers and healthcare professionals adhere to the AMS program, encourage each other to comply with antibiotic prescribing guidelines, and encourage the citizens to comply with their doctor's prescription and instructions. And I end my testimony with this message: to preserve antibiotics and prevent AMR and HEIs is everyone's duty. Thank you so much for this opportunity and for your attention.
And thank you to Maria for sending us this audio clip and for making all these very good points, many of them that we'll return to later as we look at this patient's experience of AMR and the importance of antimicrobial stewardship programs. Indeed, Maria's journey asks some very meaningful questions of us. Firstly, shouldn't all patients be safe in hospital? Secondly, shouldn't our ability to treat infections be improving and not deteriorating? And then maybe the third question that she touches upon there, which I know the Minister is going to speak to a little later, would be regarding our commitment to preventing disease and how this should be translated, into funding and action, bearing in mind the points that I raised earlier about the national action plans and the lack of financing at national level for these action plans. So at the Regional Committee, at Regional Committee 73 in Astana, we also heard from Maria, and we heard from dozens of other survivors who we were very grateful could contribute to the discussions through either their stories or joining us at the Regional Committee. And at that same Regional Committee, we saw a roadmap endorsed by the 53 member states of the European region on AMR. So I'm going to ask Danilo Lofa-Wong, who's our regional advisor on AMR, to say a few words about the roadmap before we proceed with the panel discussion. Thank you, Danilo.
Thank you very much, Rob, and good morning, everybody. It will be my pleasure to introduce to you the new antimicrobial resistance roadmap for the WHO European region, which was just adopted. And what we're trying to, I'm going to go over there because it's a very small and cozy group. And there's one part of the slides that I have to get close to read because my eyesight, together with antimicrobial resistance, is going in the wrong direction. So I think it's really important that we ask this question because antimicrobial resistance is actually, it's an indicator of things going wrong in our health system. It affects our ability to prevent, control, and treat antimicrobial resistance. So yes, I think the answer to the eroding trust in the health system is quite obvious. Anyway, let's go through this. It's also very small, I'm really sorry, but you can see the details online, and we're actually working on a publication that will get out early next year, somewhere in January, with plenty of details. But let's just have the overview of the roadmap at a glance. Starting with the vision that I will read for you. So it's a roadmap that runs until 2030. So I think that's a good time, not that we'll be done by dealing with antimicrobial resistance in 2030, but it's a good time to reflect where do we get to and what is next. So the vision for the roadmap is that by 2030, people and animals are safer from hard-to-treat resistant infections in healthier environments. And by using the words people, animals, and environment, we're already pointing towards the first principle of the roadmap, which is to look at health through a One Health lens. And the other three principles are extremely important and relevant to this conference, is that we have a people-centered approach, strong focus on equity, and we're not looking at antimicrobial resistance as the effect on the ability to treat infections, but looking at it more from a broader health system. Then, to reach this vision, we've identified 3 outcomes. The first one is about prevention, second one is about control, and the third one is about treatment, or to have the continued ability to treat. Then we have identified 5 action areas that are linked to these outcomes through color coding. So the first 2 are linked to the prevent outcome and are about prevention and control and environmental and social determinants. And the second action area, this is really the new part, the innovative part, where we go away from just looking at it as we're not able to treat infections, but looking at it more as a broader system, a people-centered community view. The second 2 action areas are related to the control outcome and are about stewardship in the broadest sense of the word, and community awareness and enabling behaviors. The final action area is about the third outcome and is about access to medicines and health products, which includes also diagnostics. Now, these action areas, we would not be able to implement those without having enabling areas as well. And here we identify 6 of them: regulations and legislation, governance and leadership, surveillance, laboratory, workforce, and finally, research, innovation, and digital technology. And these 5 action areas and 6 enabling areas altogether have 53 evidence-based interventions. So these are interventions that we know work somewhere in some context. So the idea is that countries are moving forward. They're trying out these interventions in their own context and making that work. So these 53 interventions it's not a recipe for setting up an AMR effort. It's a menu to choose from. And we want member states to choose. We don't want them to do everything. We've proven so far that you cannot do everything. You have to make choices. But you make choices among things that we know work. So we basically have reshaped the roadmap into a compass where we want to help countries navigate their implementation. And the compass, as you can see, it has all the elements. It has the principles in the middle, it has the 5 action areas color-coded by outcomes, and it has the enablers as an envelope around the compass. We want to use this compass as a diagnostic tool where we help countries assess their national AMR capacity and any of these interventions, then make a choice, make national priorities, set targets for these, like where do we want to be 7 years from now? And then how do we get there? And finally, of course, implement the evidence-based interventions that were chosen and use this process regularly to evaluate the progress. Now, and this is why I'm getting even closer to the screen. We've identified lots of these intervention areas that are truly people-centered. For example, on prevention and control, tailoring prevention and control interventions to the local context, informed by behavioral and cultural insights, including infection prevention and control programs in all facilities, to ensure quality of care and patient safety, as well as broader co-created health promotion and disease prevention programs, including water and sanitation, hygiene, vaccinations, and food production. An example for the action area environmental and social determinants is people's living conditions. Now here, at least for me personally, I was on uncharted territory. I'd never really had to think too much about it, but people living conditions, tackling the environment and social determinants, and mitigating the exposure and impact of AMR on people, for example, occupational conditions, wastewater and solid waste management, housing conditions, financial protection, and access to basic health services for refugees and migrants. For the access to medicines and health products, an example of people-centered approach is ensuring equitable access. Equitable access to rapid diagnostics or point-of-care testing and to appropriate healthcare and treatment. Understanding people's practitioners and structural barriers and drivers is a key part of this. For stewardship, we've developed this behavioral insight methodology, which was very much based and inspired on the immunization behavioral work that Rob was leading in a previous life. We call it tailoring antimicrobial stewardship programs to ensure appropriate antimicrobial use, enhancing patient outcomes, reducing AMR and healthcare-associated infections, using a behavioral and cultural insights approach. And finally, the final example on community awareness and enabling behaviors is applying these scientific and participatory methods to raise awareness and enable behavior change. Just want to end with 2 quick examples of a survey that has been done in the EU EA countries since, I think, 2009, which asks us a lot of questions about people's perception and behavior around antimicrobial resistance. And last year, led by my colleague Ketty, who's sitting up front here, we used the exact same survey in 14 countries outside the EU/EA to try to get some baseline information. And the plan is in 2025 to do this pan-European together with the European Commission. But one of the questions was about what are the most frequent sources of information on unnecessary antibiotic use? And even though there are some differences, in both cases, the information from a doctor usually comes from a doctor, both in EU/EA and in the other countries that we surveyed. But maybe more importantly, where's the trust? And here there was a full alignment between the top three. So the most relied sources of trustworthy information on antibiotics came first of all from a doctor, then a pharmacy, and then a hospital. So this information is really important to start understanding, how people perceive antibiotics, their usage, how they see the threats, etc. So this is important information, and through regular surveys we can monitor the trends in that. So with that, I'll leave you with a picture of the exhibition that we had at the regional committee. And this is, on the right side, is the entry of the reception area of the UN City, where we had these pillars with 4 stories of not only survivors, but anybody who has anything about antimicrobial resistance. Could be a restaurant owner, could be a veterinarian, could be a farmer, etc. So we just launched this one-year campaign where each week we'll post a story on AMR from all the countries around the region. So, and it will probably continue because we have 53 member states in only 52 weeks. So we will continue this. Anyway, thank you for your attention, and I'm looking forward to the discussion. Back to you, Rob.
Yeah, thanks very much, Danilo. Oh, thanks. Thanks very much, Danilo, for this snapshot of the AMR roadmap, and also some brief sort of take-homes from the survey findings. Very grateful for that. Indeed, again, we hear again, AMR is everybody's responsibility. So as we move to the panel now, I'd invite you each to think about what your individual and then your organizational or collective role is in the fight against AMR. And I'd like to first introduce you all to Claudia Luati, the head of policy at the European Patients Forum. And Claudia, if you could just maybe express, I mean, with Maria in mind and Maria's story in mind, maybe if you can tell us a little bit more about the role of the Patients Forum, the European Patients Forum, in the context of AMR, but also what your organization can do to support people like Maria. Thank you, Claudia.
Thank you very much, Rob, and thank you very much for having me today and talk about this topic. Indeed, it was a very powerful testimony from Maria this morning. So just a few words about the European Patients Forum first. We're an umbrella organization at European level. We're cross diseases, so we address all topics that have relevance for chronic disease patients. We have 79 member organizations. We don't have individual members, but we have member organizations that are either umbrella disease-specific organizations at EU level or national coalitions. And of course, for us, and for chronic disease patients, AMR is a really important issue because obviously chronic disease patients have a lot of interactions with the healthcare systems. And so, of course, they're more at risk in that sense. And also what we don't know is that a lot of procedures that are related to treatment and management of chronic diseases require antibiotics. So it's important that these products remain effective. So what we can do at EPF, but also at our members level, there are a number of ways that patient organizations can play a role in this. One of them, and I mentioned it a little bit yesterday, is really about health literacy, how we inform patients, we raise awareness of the issue and of the role that they can play at their individual level in order to make sure that antibiotics and antimicrobials remain effective. I think there's also a lot of engagement that can be done at national level. You were mentioning in the survey that that doctors are the most trusted interlocutor for patients. And I think working with healthcare professional organizations as patient organizations to find the right way to convey the information to patients is something we can do. Of course, there is the policy level as well. We can continue raising awareness of the issue among policymakers, making sure the issue stays on the agenda. And we can build partnerships as well. We're part of a number of networks, and I think the more we get together on this issue, and the more effective we can be.
Thanks very much, Claudia, particularly for highlighting the point of partnerships, which we're going to return to in about 5 or 10 minutes, but also for sharing the patient advocacy work that you lead and highlighting how, of course, this work can shape healthcare policy. So now I'm going to rapidly move us onwards, but we're going to come back to you, Claudia, shortly. Now I have the pleasure of introducing you to Ingrid Schmidt, who is the Senior Advisor of the National Board of Health and Welfare in Sweden. Of course, Sweden is extremely well known for its strong advocacy and pioneering in the fight against AMR. You are the only country in our region, possibly globally, or the first at least, with an AMR ambassador, Malin Graber, who also joined us in Astana for the Regional Committee AMR session and had a few words to say on that occasion, which we were very grateful for. I'm wondering, Ingrid, if you can share with us the Swedish experience in terms of how you've addressed AMR through a people-centered approach, but more than that, can you share examples and lessons learned for building trust and driving this health system transformation from the Swedish context that Danilo referred to earlier in his statement? Thank you.
Thank you, and thank you for inviting me to comment on this. I am happy that this conference has trust as a main theme. I used to be a pharmacist before a long time back in the 80s, and I remember my professors telling me about that this is what you need to handle in the future. And I talked a little bit to Malin, our ambassador, before this setting, and she was really happy that this was happening also and discussed also in this meeting. I think for a number of fortunate circumstances that has to do with trust in the Swedish context, we have been, as you said, fortunate in having low levels of resistance, and also we have worked with trust between professionals. We work a lot with multidisciplinary teams. We have always had backup from our government in fighting this health threat. So there are many actors involved in building the possibility for that fortunate situation that we have in Sweden. Although it's a threat also in Sweden. The levels are rising. We are traveling. We are living in this global world. So we need to work together across borders. These threats doesn't respect national borders. So I think it's the reason why Sweden has had this as a priority in many presidency. We had the presidency in the European Union this past or in the spring, and we had AMR again on our top priority list there. I would say that, first of all, as you said also, and that we heard from Maria, that where trust is shaped is in meetings between the healthcare professionals and the patients. And I think in Sweden, it's like 6 million meetings yearly among health providers and patients. And that's where trust is shaped, and that's where also shared decision-making and information is shared according to this important issue. So I mean, the foundation is to get forward with this is, of course, people and patient-centered care. But at the moment, we are working with several different projects that take in all society and also from a One Health approach that you lined up in the roadmap for WHO. So I would say, I mean, it's hard to point out one single factor that has contributed to this fortunate situation in Sweden, but it has definitely to do with trust and co-creation between healthcare providers, patients, and governmental institutions, with strong support from our political leaders also in this prioritizing.
Thanks very much, Ingrid. And once again for emphasizing that this should not be termed a silent pandemic, because I think what you really emphasized there was the importance of remaining vigilant and not letting complacency set in. And indeed, Sweden did put this very high on the EU presidency agenda, which we, I know at WHO, really felt was a very positive step forward. And I think the member states of the EU also felt the same. So I think a congratulations for that. Long may it continue that the presidencies turn their attention and hold this in very high regard in terms of prioritizing it. So I'm going to shift to the role of health professionals now. Thank you, Ingrid. I'm going to shift to the role of health professionals now with Dr. Nicolae Dragos-Garofil, who's surgeon and quality of care advisor to the Romanian Minister, our dear friend, Minister Rafila, and I'm very grateful that you could be with us today, Nicolae. We've heard about the serious consequences patients face. We heard about it right at the beginning and the top of this session today from Maria, and we know that across the region and globally, the ability to treat infections is deteriorating. So I would just like to put to you, how do you feel that health professionals can change practices to address AMR, and maybe your perspectives on improving patient safety and quality of care would be very useful as well. Thanks, Nicolae.
Good morning, everyone. Thank you for having me here in this panel. Thank you, Rob, for the question. Actually, this is what I wanted to talk to you from my perspective as a practicing surgeon and not as a representative of the Ministry of Health in Romania. As a surgeon, I deal with the repercussions of AMR in my daily activity. So the first point I would like to emphasize is the sheer emergency of our collective response. Antimicrobial resistance is upon us, is eroding our work, is affecting our medical arsenal and our effectiveness in treating patients. So as a surgeon, I had patients that just a few years ago would have had a straightforward recovery, and today every single infection turns into a complex battle. Minor surgeries or routine procedures harbor immense risk. So to address your question, I believe the first thing for all of us health professionals is to acknowledge our share of the blame in generating AMR. Of course, it's a multifactorial, complex problem. I recall some 15 years ago in when Romanian hospitals were really struggling with underfinance. My hospital in Bucharest was no exception. The only antibiotic we had was a broad-spectrum one. And in the middle of the treatment, the pharmacy will tell us that the antibiotic stock is over, so we had to switch to another. So this should be things of the past, but unfortunately there aren't. They still go on in certain parts of Romania, and I'm sure in many other countries. However, the main fault, I believe, lies within ourselves, the health professionals, the attending physicians, with good intentions for the immediate good of the patient. We tend to overdo. We tend to prescribe and prolong the duration of the treatment with antibiotic. We tend to use powerful antibiotics instead of targeted ones. We tend to use them prophylactically when there is no need to. This practice replicated across the healthcare system, I believe, is one of the main causes of AMR. But this way of thinking is deeply ingrained in within us. Uh, how many times did I not say better safe than sorry? Yeah. So this needs to change. We require a paradigm shift, moving away from this quick fix towards a more judicial and targeted antibiotic use. And the change, I believe, is difficult to occur solely from within the healthcare professional community. This has to be enforced by policy. The minister in me talking. So we have examples of good practice with other sorts of drugs, like psychiatric medication, who are very well regulated and controlled in Romania. So I don't think it will be a problem to have strict prescribing and protocols for antibiotics with clear indication, dosage, and treatment durations for each infectious pathology. With stewardship programs, they should be enforced all across the health system. Also believe that every healthcare practitioner should undergo training, periodic training, and stay informed about the latest protocols and guidelines for antimicrobials. In 2006, I remember I was a sixth-year medical student and I had an observership in Chicago. And it was really, I was really amazed that the doctors, the attending physicians there were required by the hospital manager to wear upon them at all time a protocol for prescribing antibiotic. It was eye-widening experience. First time I understood the importance of AMR, and in Romania this was no subject to be discussed. Usually it takes a few years for new medical technologies, good practice to reach Romania. But it's been 18 years and still I haven't seen, nor myself, nor other colleague, wear such a protocol. So in conclusion, I believe we still are a part of the problem, but I'm optimistic that in the near future, health professional should become a part of the solution. Thank you.
Nicely said. So healthcare professionals as part of the solution, but also key in building trust among patients, communities, and the public. And you also emphasized there, and I do appreciate you being very honest and open with us, speaking to this sort of landmark moment in your life and profession in 2006, but also emphasizing that 2006 was 18 years ago and that we've still got a long way to go today in addressing and tackling this issue. So thank you very much for that. Dr. Dragos, you also referred to the role and the importance of supportive policy and leadership. So I'm going to use that point to spring over to our next panelist. And last but not least, I have the honor of introducing you all to the new Minister of Health of Montenegro, Dr. Simon. It is an absolute pleasure to have you with us. Congratulations on your appointment. We're very happy to have you talking to us today about the facing and the competing priorities that you face. Given that this is such a multifactorial, multi-sectoral challenge, I wondered if you could talk about, and the fact that there are such limited resources available to you as a Minister of Health from your dear friend, the Minister of Finance. How do you go about prioritizing an investment in interventions against AMR using this people-centered lens that we've been speaking about today? Thank you, Minister.
Well, Rob, thank you for this inspiring introduction. I want also to greet my colleagues and the attendees on behalf of the Ministry of Health of Montenegro. And as we know well, the antimicrobial resistance is a global emergency happening before our eyes, and with a menace to bring us back to the pre-antibiotic era. As a parent, as a doctor, and as a minister, I am very concerned about this situation. And I think that we cannot leave this global problem for our children to solve, because I'm afraid that then it will be too late. One of the first things that landed on my desk when I took the ministry was the WHO AMR roadmap, recently adopted in Astana, as a compass to help us navigate through this complexity of solving the AMR situation. And I want to put something of an introduction of the state in my country about this problem. Well, consumption of antibiotics in Montenegro is on a worrisome high level. It is about 31.6 daily defined doses per 1,000 inhabitants per day. That is about 62% above the EU average. And that ranks us on the second place after the Turkey in Europe. So that is very, very worrisome. Also, I must say that on the top of the list is azithromycin. It is antibiotic which was used very much during the COVID pandemic, and it still remains on the top of our list. Then tetracyclines, sulfonamides, penicillins, but azithromycin is the first. Also, we have a rising percentage of intra-hospital infections. It was 0.3 in 2016. Now it is 0.9. And also the usage of reserved antibiotics. Well, it is a complex challenge managing this AMR problem, but we need complex solutions and systematic approach. We have done something in last few years in this fight. We have adopted national guidelines for urinary and respiratory tract diseases, meaning how to use antibiotics and how to treat them. But we can do a little better with implementation of those. We have also digital tools for clinical assessment systems, which help us to guide the therapy according to guidelines. And that reduced overall antibiotic usage for 10% and of fluoroquinolones by 20% for urinary tract infections. So it is something of an improvement. Also, we have procured the point-of-care tests, such as for COVID and many others. And we have formed a national committee for combating AMR. So that is something of a novelty for us. Well, those are things that we have done. But what about the things we plan to achieve? We have 4 main goals. The first one is advanced system for tracing antimicrobial medicines and antimicrobial resistance. We are going to implement a new track and trace informational system in 2024, which will allow us to follow the pathway of a certain pharmaceutical. And that is of importance to rationalize the usage of antibiotics, to put it under control. Also, the second and very important goal is optimization of medication in human medicine. What I mean by that? Many things. Well, we must raise awareness in population about harmfulness of overuse and misuse of antibiotics. That is very important. But how to raise awareness? Well, we must educate healthcare workers to better implement the guidelines, to be educated, competent, and then from that healthcare worker who is educated and competent, the patient will gain trust of his. So, building trust is crucial. And I think that is the way. We are also going to improve the use of aware antibiotics following the WHO tool from 2017 and agreed targets, and to optimize the use also of reserved antibiotics in our country or in our hospitals. Doctor said something about prophylaxis. I was working in gynecology department of Clinical Center of Montenegro. We do some kind of a short prophylaxis for operations. We administer 1 dose of antibiotic 2 hours before the operation, and that is all. For C-sections, for smaller laparoscopic operations, or smaller open operations. Only 1 dose. That is something that we use in gynecology department, and we are, I think, only one in the clinical center. Maybe also abdominal surgery, and that's all. So that is some kind of a program that we can improve, but the usage of antibiotics is very, very high on primary healthcare centers. So that is the point we must address. Also, one of the goals is optimization of medication in veterinary medicine. We know that. And the 4th our goal is to reduce the environmental pollution by antibiotics. We are going to initiate the creation of a new state plan for waste disposal with an accent of disposal on antibiotics. So those are main goals which will be brought by some interventions. But for those interventions to have and deliver sustainable results, that must be done only through synergy. Synergy and multi-sectoral collaboration. So my intention as a minister is to insist on a transformation. Transformation is one of our themes. Well, through innovation and inclusive processes, to implement people-centered interventions that will deliver impact. I think it is only when the patient and our citizens feel tangible benefits that they will then the trust will be restored, and they will trust us. And what about those targeted interventions? Well, for targeted interventions, we need data. In the data department, Montenegro is not very good. We have problems in that department. That is one of our priority of my administration, to move up the digitalization, to center the data collection, and also to change the law for data recording for our patient and in healthcare systems. Also, I am looking forward to the results of the first point prevalence survey done in Montenegro with WHO support. And then I think I will get a better understanding of the magnitude of this problem, of the use of antibiotics, healthcare-associated infections, and the level of AMR in our hospitals. So these findings, PPS findings, will help us formulate the framework for infection prevention and control system. Also, I must say that I think we may provide a sustainable solution from the AMR emergency only through One Health approach. 2 weeks ago, in Montenegro, in our capital, Podgorica, we marked Antibiotics Awareness Week, and we had a meeting with WHO support, and we brought together representatives of all sectors, from health, veterinary, food sector, and environment sector. And we send a strong message from that meeting. Cross-sectoral collaboration based on One Health approach has no alternative. I think that it is the key and the best way for resolving this and many other grave problems. So, thank you for now. That is my message.
Thank you very much, Minister. Yeah, absolutely. Thank you very much, Minister. And I might start by thanking the colleagues, your colleagues in the Ministry of Health and our dear Dr. Mina Brajovic for making sure that the AMR roadmap was the first thing on your desk when you arrived in office. That's very good news. Really appreciating the points that you made in terms of the transformative action that you mentioned around track and trace, education, healthcare workers, the nexus with primary healthcare you spoke to, and of course, veterinary medicines and environmental pollution and tackling these. And you're not just talking a talk on One Health. It does seem that you're walking this talk on One Health with the plan ahead, which I think is a very, very positive signal to us all. And I think the future is extremely bright in Montenegro, in your hands. I also have to...
We've had the government meeting yesterday, electronical, about the budget.
Yes.
And this year budget, next year budget will be 20 million more, and it is the biggest budget.
Bravo. Bravo. That's the difference good leadership can make. So, and also I appreciate that you've recognized the weaknesses of the system and you've recognized where Montenegro is and how you have to do, how you'd like to do a better job in the future. And that's a future where the blockbuster movie I was talking about at the beginning of this session, that's not taking place in Montenegro, right? Because,
well,
no, it's not. I won't buy that. It can't happen in Montenegro, not under your leadership. So I'm very grateful for that. Listen, I realize I'm looking at the clock. I think I'm going to move us now forward. Claudia, Ingrid, Nikolai, Minister Simon, and Danilo, thank you very much for your interventions. I'm going to open for a few questions now from the floor. To see if anybody would like to ask a question of any of our panelists, or points that you would like to raise in terms of, does antimicrobial resistance in the country or the setting in which you work erode trust and confidence from your constituencies or from the public? I think the answer is, from me, is yes. In Denmark, there is considerable concern about people accessing healthcare and contracting diseases, and where hospitals are increasingly being seen as places that are not safe places to be, which itself is an indicator that we are losing this trust and confidence. But I wonder if others want to share their perspectives or anybody would like to ask a question of the panelists. Thank you. And I will have to put my hand up because I can't see you through the light. Yes, please. Do we have a... Yeah, thank you.
Thank you very much. My name is Razvan Gai. I'm speaking on behalf of my colleagues from European Trade Union Social Services. I'm a representative also from Romania in Health and Social Services as a trade unionist. I have a lot of... maybe I have a comment because we support on the European level very much continued professional development. And I think in relation with the regulatory bodies, especially for the doctors, pharmacists and nurses, can be very important stakeholders taking in consideration all about AMR. Because could be a possibility, just an idea, I have this in this room, this idea to put it somehow in the continued professional development for the professional in the health sector to be mandatory, to have something very clear, very specific path to follow for the professional. Could be a possibility. You can rely on us because we represent more than 8 billion workers in the health sector and in other public sector, maybe 3 million in the healthcare sector and the care area in European Public Services Union. Thank you.
Continued professional development, but the second point, and maybe the point that may be more contentious, is mandating this and making it compulsory. So I'm going to turn to our panelists to see if anybody has an opinion on this, because I think this could be quite an interesting discussion. Please, Ingrid.
No, I can just comment. We don't have it mandatory, but it's a decentralized system. So, but this specific topic has been taken forward by engaged physicians and other healthcare workers, and they have formed like action groups that works in all regions, and go to healthcare center, have this kind of continuing medical education, and we are kind of fortunate in a way because there is a lot of evidence how to perform these kind of activities in healthcare, actually. And it's effective. You could see, when these groups started to work in Sweden, you could see a drop in prescribing quite fast, actually. So that is a really good investment tips, I think, for whoever pays for your activities. But that has been, we have seen that is really effective, but it has to be targeted on prioritizing on a system level also, and making your policymakers understand that this is something we need to do related to continuing medical education. So we saw that drop. I mean, didn't take long time, but then they were out everywhere, and it was like a network situation where they also communicated with local policymakers. So it's kind of possible.
Yeah, Danilo, I was going to come to you next. Thanks, Ingrid. I was going to come to you next. I'm sure you've got a point related to this, but maybe just to also explain to us, are there areas or other countries in the region where such education is mandated or made compulsory?
Oh, that's a very good question. I don't think compulsory anywhere.
No, it's not in Sweden either.
No.
Well, if it's not in Sweden, then it's
No, it's
nowhere,
not in
probably.
Yeah.
No, first of all, before I just want to acknowledge Romania's EU presidency a number of years ago, where AMR was also very high on the agenda, and a very successful meeting led to some council conclusions. It is exactly what we have been talking about, and we are still talking about it. Of course, as WHO, we don't have the mandate to make things mandatory. We can only point out what is common sense. And of course, continued learning is really important, but we also make the argument that before that, it should be part of the curriculum and even further back. I mean, there's many aspects that are driving antimicrobial resistance, such as basic hygiene and all these things, that should become second nature from childhood on. So there's a long pathway of learning, but certainly with the current workforce, some of them will not have been exposed a lot to the threats of AMR, and they need to be aware. Because I think everybody in health profession, they do not want to do harm. So they need to understand that some of the things they're doing are actually not helpful. But yeah, thank you very much for bringing that up.
Please, Lina, do we have a microphone? Thank you.
Done. Okay. So my name is Mina, and I'm WHO representative in Montenegro. And I would like to greet and commend all panelists. It was really a pleasure attending this session. And I would like actually to take advantage to share my personal experience, because you heard that Mr. Minister is actually brand new with, I think, maybe 3-4 weeks time in the hot chair. That it was for me, after 15 years of work with WHO, it was a total surprise to see how someone with clinical background, clinician plus politician, has that feeling and sense for public health and for something which is crucial and core interventions such as addressing AMR in the country. So I already feel privileged by having an opportunity to collaborate with this profile of the minister. The key reason why I actually asked for the floor is to build on what Mr. Minister said, namely, and obviously, and I fully agree that AMR is definitely a very complex challenge which requires complex solutions and work across sectors and many interventions and several tracks we need to work. But one of them is actually access to antibiotics. Data are telling us, as Minister also highlighted, that in Montenegro we have a habit to consume a lot, particularly reserve antibiotics. And we consume them when we have a headache, when we feel unhappy, depressed, whatever, we consume a lot of antibiotics. But if we want to support Montenegro to actually deliver on AMR and ensure that there is prudent and rational use of antibiotics, then we also need to support to find a way, probably in strong collaboration with EU, to find actually a way to have smooth and easy access 2 first-line generation antibiotics, which are missing in Montenegro, believe or not. And Montenegro is not the only country. There are also other neighboring countries in the Western Balkan that are actually faced with the same challenge. So my suggestion would be that we as WHO, a strategic partner to our respected member states, that we actually accelerate our consultations with the European Union to help actually, particularly the candidate countries such as Montenegro, to help them actually join. Hopefully it would be feasible, and given the fact that I have a legal background, I'm a lawyer, I know that we lawyers can be very creative when we want to find a way to ensure that candidate country becomes also part of the EU joint pooled procurement mechanism. Otherwise, it would be very difficult to expect that particularly small country actually would be able to access life-saving medicines such as those basic like penicillin or similar antibiotics. And one more point, we learned many lessons during COVID, but one of them is that there were no small and big countries. And that we are as strong as each and every segment of our response. That's why we have to make sure that the small countries and small systems are as strong as any other if we really want to be super resilient. So thank you once again to panelists. It was really very inspiring. Thank you.
Thank you very much, Mina. We're only as strong as the smallest element or composite. Very good point. And also regarding access, Danilo, do you want to add something? I see our clock is running down to 1 minute now. Can I give you 20 seconds on access and the point that's just been raised on access?
Yeah, I mean, access has been very much part of the Swedish EU presidency, but also part of the thinking behind the roadmap. There's a whole action area dedicated to that, and a big part of that action area is the newly launched Novel Medicines platform, which is all about fostering the dialogue between public and private sectors, making sure that there's access not only to new antibiotics when they come out, but also to existing antibiotics. And it is trying to get that discussion going on co-procurement and development of new antibiotics. Thank you. So working on it, yes.
Thanks very much, Danilo. Honourable Minister, thank you for your time today and for joining us. Claudia, Ingrid, Nikolai, thank you very much. I'm going to have to draw us to a close. I was scribbling some notes in terms of take-homes messages, and I've got 3, I think, for us. The first was that a people-centered approach acknowledges the role of individuals and communities in tackling AMR, helping to address weaknesses, but also in gaps in AMR efforts to date, and how it can facilitate a co-creation of the health system transformation and, of course, build trust, which you've all spoken to. The second point was regarding the healthcare professionals, which I think was a point made very clearly, being the sort of the center point or stewards of antimicrobials, but also, of course, again, playing a paramount role in ensuring effectiveness through treatment and quality of care. And the third point was related to policymakers and the need to prioritize and invest in the importance and the value of strong leadership in implementation of high-impact interventions using this, if we can call it, people-centered lens. And again, with reference to the roadmap, I think there's plenty of good stuff in the AMR roadmap with these 53 interventions that are captured in the roadmap, many of which are not just innovative, but tried and tested, proven interventions for high impact at the national and local levels. So with that, I'm going to thank you all. I'm sorry we've rushed a little bit at the end there. I had a series of other questions I would have loved to pose to you all, which I'll do so over coffee. But thank you all for your attention. Thanks for attending and joining us today. And I wish you, of course, a very good day ahead of you. Thank you again.